Hello, this is Dr. Dinara, and today we're talking about asthma management. So, asthma management is a step-by-step approach. So, if it's a flare-ups, if you feel cough, shortness of breath, you need to go up the next step. If it's everything is okay, it's a controlled asthma, we need to go down. The first step is SABA. It's a short-acting beta-2 agonists as needed, just to have this shortness of breath, for example. And the second step, budesonide formoterol, just as needed, or you can take every day inhaled corticosteroids at low dose, and also SABA or short-acting beta agonists like salbutamol as needed. The third step, it will be again, you will every day will take inhaled corticosteroids, but in this case, in the third step, you will take it with LABA. So it's a long-acting beta-2 agonists, yeah? Like in this case, formoterol. So you will take it every day, but also you can take the same medication at low dose if it's as needed. And the second choice in the third step, you also can take, again, inhaled corticosteroids with LABA, plus, as needed, you can take SABA, so this salbutamol. In the fourth step, the medications are the same, but in this case, we will take these inhaled corticosteroids and LABA like formoterol in medium or high dose. So will be added more and more dosage of this medication until you feel that much better, yeah. And when you feel better for some time, we can step down and, for example, to give a lower dose of these medications. So as you can see, management for kids is a bit different. And in this case, but the first step is the same. So we give SABA or salbutamol as needed. The second step here we'll be giving is inhaled corticosteroids at low dose or montelukast. So montelukast in here is just for kids. The third step is inhaled corticosteroids at low dose with montelukast, or we can give inhaled corticosteroids at high pediatric dosage. So as you can see, it's up to 5 years old child. And so next step. Okay, this one is age from 6 to 11. Almost everything is the same, but just one thing is different. It's just we can add LABA with inhaled corticosteroids at low dose in the third step. So now let's talk about asthma attack. What signs of asthma attack? It's increasing wheezing, cough, chest tightness, shortness of breath. You're walking often at night with asthma symptoms and you need to use your blue puffer again and again within 3 hours. So your symptoms will get worse very, very quickly. It will be severe shortness of breath. You can't speak the whole sentences with just some words and your lips are blue. You get little or no relief from your reliever inhaler. So like a blue puffer or gray puffer. So what you should to do? If you aren't sure what to do, your symptoms is progressing. So the good thing to do is just to call 000 emergency and just to use your blue puffer if you are age 12 and older. So, and what you should to do? Okay, sit the person comfortably upright. So you can see you will use your inhaler with spacer. So you puff into spacer, just one puff, and you need to breathe in 4 times, Then you will repeat the same thing with 4 puffs. Then you should wait 4 minutes. And what next to do after these 4 minutes? It could be 3 different options. So for example, it's a worse or no better. We just call 000, for ambulance. and we'll just keeping to do this 4 puffs every 4 minutes. What to do next? If it's, for example, still hard to breathe, yeah, you need to do this 4 puffs again and to wait a bit, just a few minutes. If it doesn't help, you will call 000. If you breathe normally, so you feel much better, you just you don't need to do anything, just to go to a doctor for a checkup. Yeah. So as you can see, it's very important to use your blue puffer with spacer correctly, like here. And now about kids. So what with kids? The treatment will be the same. Actually, it's again 4 puffers, and you need to wait 4 minutes. And if it's getting worse, nothing better, so you will just call 000. What's the difference? Just a little difference about younger children. So you, in this case, you need to use a mask, also spacer and inhaler. Yeah. So that's all. Thank you very much for watching this video. This was Dr. Dinara, and see you next time.